Hi, my name is Julie Boyce with the United States University S&P 592. Today I'm going to be talking about obesity and musculoskeletal system with Professor Karen Mackel. These are some of the highlights that I will be mentioning in the PowerPoint as we move forward. What is obesity? What condition associated with the musculoskeletal system is caused by obesity? What joints are affected? And I just wanted to put in the percentage of people affected by obesity. 78 million adults and 12 million children are obese, and this was according to the National Conference State Legislature in 2014. In the bottom right hand corner, I had put in, according to the NCHS data brief in 2017, just highlights of how much it had changed and how much it's affecting the population according to the age 20 and over. And it's also is by men and women. And if you notice, it goes all the way up to 60 and over. I remember when I was younger, I saw a lot of elderly people, and I don't remember them really being overweight, but I do have now in this population a very large population of obese elderly. But I just want to throw this in here to let you know what I'll be moving forward with in the PowerPoint. I'm just going to give you a brief definition about what is obesity. And here I pointed out obesity is a body mass index of 30 kilograms per meter per squared. It's supposed to be squared. There are two types of obesity. Obesity is the excess of adipose tissue known as body fat. And they describe this in the readings that I found as an apple shape for the upper body and a pear shape for the lower body. And it's often classified by overeating. I just want to hit the highlights on the apple shape. We know obesity already causes many health care problems associated with people. But they say that people with the upper body fat, such as in the abdomen or the flank areas, are increased to develop heart problems such as diabetes and heart disease. And as I mentioned, also osteoarthritis. Now, I'm not saying that everyone who is overweight will have this condition or develop osteoarthritis, but we just want to hit the highlights and know that being obese is really not good for our health. And the lower body is considered the pear shape. You still develop health problems with the pear shape, but they say they're less likely to develop some of the other conditions that I mentioned before. I feel like that sometimes we go into denial about the causes of obesity. I talk to many patients, and sometimes even in my current family, they would say, "Well, I don't eat that much, and I walk around all day." So a lot of times you have to really hit the highlights and just break down the 24-hour diet that a person is having. Sometimes in 24 hours, if you sit back and think, you'll be saying, "Oh, I ate more than I thought." Especially since I've been in school, I haven't been active as like I want to, and I've been taking in a lot of snacks, so I know I put on about 10 pounds. But 35% of men and 36% of women are obese. And it says that African American women are more likely to be obese than white women. And also associated with the causes of obesity is a lower social economic status, regardless of race. And I guess, if you're surviving or trying to live, you don't really think about the health risk. And when I was doing home health, there was often times when I would go to people's houses and would have to go to the food bank to collect food for them. And it was like canned goods and a lot of processed food, something they can quickly cook. But I noticed now some of the places are giving out more fresh vegetables, frozen meats, chicken, a lot of beef, and so I think they're coming into reality that even though they may not be able to afford certain foods, that their health is still in consideration. Intake of twice the calories. I remember when I was studying for my bachelor's degree, it was saying that the weight that you want to be, like you want to be 120 pounds, then you should take in about 1,200 calories a day. And I'm not sure um, how people calculate their calories, but that was just a suggestion. It was something that I learned when I was in my bachelor's program. And I know over time things have changed about making sure we have a more healthy lifestyle and caloric intake. Processed foods and refined sugars also contribute because we know these types of foods um, do not burn off easily. They kind of sit in the body and attract the fat cells. And if you look in the right hand, I did put a picture up there. We're talking about sweets, rest at home, unhealthy drinks, and junk food. And I do know that sodas carries a lot of sugar content and also a lot of extra calories. As I mentioned before, problems with obesity, um, we don't want to overlook the illnesses such as diabetes and heart disease, but I really want to focus on osteoarthritis because a lot of times we know if people are not active and not able to move around because they're in pain, that they do put on more weight, which increases their chance for diabetes and heart disease. And I put a definition here that says osteoarthritis is commonly known as wear and tear um, on the joints. It's wear and tear arthritis. It's the most common type of arthritis. It is associated with a breakdown of cartilage in joints and can occur in almost any joint in the body. And it's a weight bearing joints are most often affected. And I've noticed since I've been doing nursing over the past 24 plus years that I have to have more cushion in my shoes. I actually went and got special orthotics placed for my shoes to help relieve the pressure off my knees because my knees had begun to hurt. I also went to the doctor and had an x-ray and was shown that I didn't have any arthritis right now, but I do know repetitive use of those joints, such as your hips. You know, you have your truck drivers who have to get in and out of the truck. Sometimes they may have to lift and pull. You have your runners, you know, the knees. I had a patient one time, he was a runner, and he said that his knees just gave away, and he ended up having to have bilateral knee surgery. He did them at the same time due to osteoarthritis. And I was kind of shocked to hear that occasionally you find the fingers, thumb, and large toe get affected by, and I was trying to figure out how the large toe could get affected by, but I thought about the ballet dancers, if they're on their toes and even though they wear those point shoes. I know my daughter, she had to wear point shoes. There's still not much cushion in those shoes, so sometimes they they can damage those joints from prolonged dancing. Who is affected by osteoarthritis? Well, we already know that people that are obese has obesity are affected by osteoarthritis. Adults who are older than age 45, the older population, um, OA also occurs earlier in women and prevalence among men and women. Among advanced aging, occupational overload of the joints, people with a family history of type 2 collagen polymorphism um, is, is also, are also at risk. Let's look at the older population because we are probably in primary care going to be dealing with the older population. And that's been my specialty since I started nursing. I always had um, the care for the older population. And I found out that a lot of times they would just sum this up as getting old. They'll say, "Oh, I'm just old. I'm just stiff in the mornings. I can't hardly walk." But we want to kind of get these patients taken care of because if they're unable to move around safely, then they're at higher risk for fractures and broken bones. And we know to have a broken bone takes more out of you. A lot of times I found out too that after a certain age, doctors do not want to operate on a person who has osteoarthritis. So if they start to have symptoms earlier in life, we need to go ahead and educate them about getting treatment before it's too late. And if you see, I put over here in the corner, it says, tells it's break down a healthy weight, and it comes from overweight and obesity. But this chart has also changed over time to 25%. I think they give you a little bit more leeway than this did, but this right here said with arthritis. So if you think about it, you take in your percentage, and you can kind of know what your risk of developing osteoarthritis. I have a family history. My mom has it, so I'm at higher risk of getting this osteoarthritis also. Now, I don't know if she has the gene, but I know she's had multiple joints replaced. So, but I just wanted to put that chart there so you can see um, what we're up against. We have a lot of work to do in teaching the populations about this obesity and how it can affect their joints. Once these people are diagnosed with obesity and they start to have osteoarthritis, we want to go ahead and make sure we do a complete history and physical and x-rays, CT scans, or MRIs. I know physical therapy is one of the priority that you want to get them in because we want to make sure that we try non-invasive techniques first. The plan must coincide with the patient. I mean, you got to make sure that they're on be on board for what's required for them. What works for one person may not work for that person. Behavior and lifestyle modification. We may even have to do pharmacologic management. I know at the current office that I work with, she does trigger point pain management, and it's with a plant-based product. Sometimes she uses the steroids, but most of the time she uses the plant-based product. And make sure we are ruling out that differential diagnosis of rheumatoid arthritis because that whole treatment plan will change if they're diagnosed with rheumatoid arthritis because they can mimic each other. And I put a test for evaluation of the knee because most people have those hips and those knees that has to be replaced over time. And these are some of the tests that we did when we was doing our musculoskeletal system, the McMurray's test and the posterior drawer test. I just wanted to put that there as evidence of doing a complete physical assessment of these patients. Preventative recommendation, obesity and OA. The reason why I think these two should go together is because obesity affects so many people and it affects our children, it affects our loved ones, our friends, our co-workers. So I just really wanted to put this preventative recommendation in here. First of all, as providers, we have to know the symptoms and provide the proper treatment. Joint stiffness, and most of the time they'll be complaining about this when they first wake up or after being active. They'll complain of that achiness, that tenderness. They'll also complain of the ability to move flexible. You know, that one time they probably could straighten the knees out, and now when they try to straighten it out, they have a pain or pulling. They would have a grating sensation because that cartilage is when it's good and strong, it's firm and rubbery. It's the material that goes over our bones, and for normal joints, we should have that there. And it's known as a shock absorber. So if that's gone, they would find that gritting sensation where the bones are actually rubbing against each other. A lot of people told me. I had one person tell me that it feels like it's grinding away, and that's exactly what it's doing. It's grinding away bone spurs and swelling at that area. We want to kind of make sure in the beginning when we start talking to our patients about their weight, maintaining their healthy weight, making out some suggestions. I put on the calendar, on the picture on the right side. I did that picture because it has a variety of different things that a person can do. Vegetables, um, fruit, water. Also, it has the barbells, anything that you can do to kind of keep yourself moving. All of us can't run, all of us can't do a jump rope, but we can all sit. And there's some exercise that people can do when they're sitting, and there's some exercise people can do in the bed. Educate the person of health risk. Go ahead and throw it out there. Hey, this is what can happen to you. Let them know from the beginning. Everybody come to your office is not may not have a problem. They just come for a physical. May they be coming from a job, but you can see those risk factors from the beginning, and make sure the patient know about the risk factors. As I mentioned earlier in the slide, with the elderly population, we want to think about the fall precaution. And we want to think about long-term pain management, and this can happen in all groups. That's a risk for addiction, so we can get the preventative care out there. Maybe we can avoid this. I put some ex, some assistant modalities at the bottom of cane or wheelchair or walker, because you may see all types that come into the your office, and they're going to have an excuse. I can't exercise because of this. I can't do this because of that. But it's still our job to kind of encourage them. And safety measures, including also infection control if they're going to be having surgery. Get those home health staff members involved. I did home health and made a lot of visits on people after they had knee replacement. In conclusion, I wanted to make sure just to do an overview of what we talked about. It was understanding the problems associated with obesity and how it can affect the musculoskeletal system. Provide the patient with a weight loss plan. Pain management for patients who are in severe pain. We may not never get them pain free, but we do want them up and functioning, and also provide information regarding aerobics. I know water aerobics is really good, and it's becoming really popular in this area. I live in Georgia, and I know companies are popping up, and they're actually going to the assisted living facilities and getting the elderly involved, which is good because most of the time they sit around all day, with not much to do. Continue reassurance and support, because they can develop depression and dealing with everything. They can't get around like they used to. They're in a lot of pain. No one seems to understand. Support needs, if you have to, by taping, splinting, or bracing until they can get the proper treatment. Also, become familiar with the local organizations that fit people for proper footwear. I found this place that's in Atlanta, outside Atlanta, Georgia. They actually have you to walk on a treadmill, measure your feet, highlight your point of pressure, and provide you with the proper orthotics, along with the proper shoes to help support your feet and prevent you from having those stress points. Assist patients in getting walkers and wheelchairs. A lot of the insurance company will pay for this, and if not, then there are organizations that would donate wheelchairs and walkers to patients, so they can be safe at all times. This is the end of my PowerPoint. Thank you for watching, and I hope you enjoyed it.